Hello friends, today I'm going to speak on the topic developmentally disabled child. What is developmental disability? Developmental disability is a diverse group of chronic conditions that are due to mental or physical impairments that begins before an individual reaches the adulthood. A disabled child is one who, over an appreciable period of time, is prevented by physical or mental conditions from fully participating in the normal activities of a child of the same age group, including those of social, recreational, education, and vocational in nature. Coming to the classification of a disabled child by Franks and Winter, there is the blind child, deaf, educationally subnormal, maladjusted, epileptic, physically handicapped, defect of speech, and senile child. Then the classification by Holloway and Swallow, there is the mentally handicapped child, physically handicapped child, and the medical disability child. And the classification by Novak, physical handicap, mental retardation, congenital defects, metabolic and systemic disorders, convulsive disorders, childhood autism, blind, and hemophilic child. So, coming to cerebral palsy, it is a birth related disorder that primarily affects the brain and the nervous system. Because of the damage to the nervous system, the motor skills of the child is affected, including his posture, his movement, ability to work will all be affected in cerebral palsy. So, coming to the types of cerebral palsy, there is a spastic type in which the tense contracted muscles are present. It is the most common type of cerebral palsy. Then there is the athetoid type with the constant uncontrolled movements of the limbs, head, and the eyes. Then there's the ataxic type with poor sense of balance, which can result in falling and stumbling. Then there is a rigidity of the tight muscles that resist effort to movement. Then the tremors of that is the uncontrolled shaking that interferes with the coordination. So we call a patient hemiplegic when one arm and one leg of the one side is affected. So if we look at that picture, we can see that the arm of the patient is bent and it is sloppy or spastic with little use. Whereas she walks on the tiptoe or the outside of the foot on the affected side. That one side is affected in hemiplegic. In paraplegic or with diplegic, both the legs will be affected and with slight involvement of the upper body. Usually the upper body is normal without any symptoms, but the child may develop contractures of the ankle and the feet. We call him or her quadriplegic when both the arms and both the legs are affected. So when he walks, his arms, head, and even his mouth will twist strangely. The children affected with four limbs usually have so much brain damage that they won't be able to walk. You can see that the knees press against each other and the legs and the feet are turned inwards. So coming to the oral manifestations, child may have gastroesophageal reflux and frequent vomiting that in turn can cause erosion and loss of tooth structure. So there is gingival overgrowth due to use of medications. The orofacial findings include the head is tensely reclined and the mouth is open and the facial movements are tensed. There is uncoordinated movement of the tongue. There is jaw dislocation and tongue thrusting during swallowing and speaking. So coming to the management of the patient is transferred to the dental head chair. A 2% lift is recommended. Make an effort to stabilize the patient's head throughout the dental procedure. Keep the patient's back slightly elevated in order to minimize swallowing. For control of the involuntary jaw movements, mouth props or mouth jaw blocks can be used. So to minimize the reflex reaction, avoid use of stimuli such as abrupt movements, turning on the lights, and noises. Introduce the intraoral stimuli slowly to avoid a gag reflex. Modification of the radiographic technique include use of 45% oblique head place and the reverse bite wing. So if possible, you can try and use a rubber dam. Coming to epilepsy. Epilepsy is a group of disorders characterized by chronic, recurrent, and paroxysmal changes in the neurological function caused by abnormalities in the electrical activity of the brain. So each episode of neurological dysfunction is called a seizure. Coming to the classification of epilepsy, the Epilepsy can be classified as partial or focal seizures, which are again subclassified as simple partial seizures, complex partial seizures, and secondary generalized partial seizures. Then there is a primarily generalized seizure, which is again subclassified into tonic-clonic seizure or the grand mal seizure, then tonic absence seizure or the petit mal seizure, then the atypical absence, myoclonic, atonic, and the infantile spasms. Then there is a status epilepticus, under which comes the tonic-clonic status. This is the tonic and the clonic phase of the patient. Then there is the absence status and epileptic partialities continua. Then under recurrent patterns come sporadic, cyclic, and reflexation. Coming to the oral manifestations of the epilepsy, soft tissue lacerations of the tongue or the buccal mucosa can be seen. There may be facial fractures. The dislocation of the TMJ may be evident. Trauma to the teeth in terms of avulsion, luxation injuries may be seen. The injuries due to drug therapy, there is gingival overgrowth or gingival hyperplasia. Recurrent aphthous ulcers may be seen. Dental anomalies like small teeth and delayed eruption may be evident. Cervical lymphadenopathy, secondary infections are common. Coming to the office management, supine position of the chair. What if an epilepsy happens during the treatment? Then a supine position of the chair, protection from injury by moving sharp objects away, insertion of the mouth prop or the rubber or the plastic to prevent tongue biting, maintenance of a patent airway, use of a suction device to avoid aspiration, give oxygen. If conditions do not improve, admit to a hospital. So the dental treatment should be of short appointments. Importance of toothbrushing should be stressed. Fixed type of appliances can be used for orthodontic treatment. So coming to the Down syndrome, it is the most recognizable malformation syndrome, which is due to trisomy of the chromosome number 21. That accounts for 95% of the cause. Translocation accounts for 3% of the cause, and mosaicism accounts for 2% of the cause. The incidence of Down syndrome is 1 in 600 live birth. So coming to the predisposing factors, advanced maternal age, uterine and placental abnormalities, and also chromosomal aberrations are the predisposing factors for Down syndrome. Coming to the general manifestations, the skull of the patient will be brachiocephalic. That is, the normal length and width ratio of the skull will be less than the normal adults. Presence of a third frontal annuli just anterior to the posterior frontal annuli. Normally, there are two frontal annuli, the anterior and the posterior frontal annuli. But in Down syndrome, a third frontal annuli may be seen just anterior to the posterior frontal annuli. The nasal bridges will be flat and small maxilla. The eyes will have oblique palpebral fissures with prominent epicanthic fold. Brush field spots on the iris may be seen. The eyelashes may be scanty. So if you look at this picture, you can see that the epicanthal folds are prominent here. These are the epicanthal folds. The oblique palpebral fissures, that is the opening of the eyelids, which are oblique. There are sparse eyelids present. And I've mentioned about brush field spots. These are the brush field spots in which you can see the redness on the either side of the eyes. So coming to the ears will be abnormal with abnormal pinna. The neck will be short and broad with excess skin posteriorly. The hands will be broad and the short, called clinodactyly, with a slight curvature in the little finger with excess loops on the fingertips. So if you look at this picture, you can see that the hands are short and broad, clinodactyl. There is slight curve of the little finger. There will be excess folds on the tip of the fingers. So coming to the muscle and joints, there is hypotonicity and hyperextensibility. The IQ of the patient with Down syndrome will be between 25 and 50. So congenital abnormalities that are seen in Down syndrome include the heart lesions like atrial septal defect, ventricular septal defect. There is duodenal atresia, that is disorders of the large intestine. And then atlantoaxial instability, disorders of the spine. umbilical hernia may be seen, multiple immunological defects. The incidence of acute lymphoblastic leukemia is 20 times more common in a patient with Down syndrome. Alzheimer's disease and hypothyroidism is common. Coming to the oral manifestations, the mouth will be small with a dropping mouth and open mouth posture is evident. The tongue will be macroglossia, large size of the tongue with protrusive posture. The lips will be thick, dry and fissured. The occlusion will be open bite occlusion with that class 3 tendency and small maxilla. The palate will be high arched, also called as omega palate, and the bifid uvula, cleft lip and cleft palate may be present. So this is the diagram which this summarizes the features. If you look at the skull, it is brachiocephalic, presence of anterior frontalenella between the anterior and posterior frontalenella. Then if you look at the eyes, there will be oblique palpebral fissure with prominent epicanthic fold, flattening of the nasal bridge, short maxilla, open mouth posture, macroglossia. Then if you look at the hands, we can see that short broad hands with slight curve of the little finger will be seen. The congenital heart defects may be seen. Then the disorders of the digestive tract will be seen. Diminished muscle tone, umbilical hernia may be seen. Unilateral bilateral absence of one teeth can also be seen. So the eruption pattern of the teeth, retarded or early shedding of the deciduous teeth. The teeth will be hypodontia, microdontia with developmental defects like hypocalcification, hypoplastic defects, and there is low incidence of caries. Coming to the dental treatment, there should be adequate dental prophylaxis should be done. The increased incidence of leukemia and acute or chronic infection of the upper respiratory tract complicates the dental treatment. Children are usually affectionate and cooperative. Nitrous oxide should be used in cautions with patients with Down syndrome. Preventive procedures along with chloroxine mouthwash is beneficial. Pulpal treatment is contraindicated in deciduous teeth because of the cardiac problems. Orthodontic management, if at all done, should be done with fixed appliances, but it will be very difficult. General anesthesia is frequently employed for treatment of such patients because they can sometimes be very uncooperative. All the restorative procedures are indicated. If periodontal disease is there, routine review, recall, and oral prophylaxis should be done. Coming to autism. Autism is a mental condition present from early childhood. It is characterized by great difficulty in communicating and forming relationship with other people, and because of the difficulty in using the language. So under the autism spectrum comes the autism disorder, Asperger's syndrome, Rett's disorder, childhood disintegrative disorder, and pervasive developmental disorder. Coming to the etiology, the genetics is the main factor. Then syndromes like Reye's syndrome and Asperger's syndrome plays an important role. Medical conditions like tuberculosis, sclerosis complex, prenatal factors like intrauterine rubella, cytomegalo diseases, virus diseases, postnatal factors like infantile spasm and herpes simplex. So coming to the clinical features of people with autism, the children seem to be sufficient introvert and wants to be alone. They have little or no attachment with their parents. They may typically display affection and anger to a toy. So coming to the dental findings, high susceptibility to caries, bruxism, damaging oral habits like tongue thrusting, lip biting, gingivitis and poor oral hygiene is seen. So coming to the treatment, allow the autistic child to bring the comfortable toy to the dental office. Make the first appointment as short and positive as possible. Approach the child in a quiet, non-threatening manner. Avoid loud noises. Invite the child to sit alone in the dental chair for some time so that he becomes familiar with the environment. Talk in a direct, positive, short, and calm way. Behavior modifications and the use of positive reinforcers can be done to promote a desirable behavior. Sometimes papu board to wrap the child can be used. So that concludes my presentation. Thank you.